Well, the new buzzword in Alzheimer's, and I mean it's a very exciting process, just discussed at great length at the national meeting, neurology meeting just a few weeks ago, is what's called biomarkers. And biomarkers are certain tests that you can do that are objective. They're not psychological or memory type tests. There's one for the spinal fluid. There's one for brain imaging, which we're actually involved in here at UT. But there's one for brain imaging, and they actually are able to measure the deposition of amyloid, which is the abnormal protein, in the brain itself. And it seems possible to make a diagnosis maybe 5 years, maybe even longer, prior to the advent of any symptoms associated with the condition. And that brings up a lot of ethical questions, but a lot of treatment opportunities, which is the critical issue.
So find it early, better.
Be sure you know what you're talking about. We talked about differential diagnosis. We believe starting treatment early is the way to go. And other very important things in treatment and management, exercise, for example. And it's not just, a casual thing like, oh, you should exercise. A Mayo Clinic study not long ago suggested that if you walk 1 mile at a normal pace 3 times a week, they can show changes on brain scan reflecting that activity. So it's serious business, this exercise. Brain exercises, doing puzzles, but there's internet companies now that are very good, and they have special brain training apparatus for memory loss, and that can help as well. The Mediterranean diet and certain nutritional issues can probably help to a certain degree as well.